My name's Craig. I'm 46 years old and I'm a Chicago Arthritis patient. For more than 2 years, I had constant pain ranging from 2 to 7 on a pain scale. I was unable to do normal activities, carrying in groceries, driving, playing with the kids, picking up anything heavier than 5 pounds. I used NSAIDs daily and began having stomach problems. I experienced frequent lack of sleep due to awakening from pain when I rolled over on my shoulder. Before being dismissed from the surgeon's office, I was told nothing else could be done after 2 prior surgeries. When getting second and third opinions, I was told insurance would not cover regenerative treatments, that stem cells would not work, and they might be harmful to me. So I began searching and reading on my own. In particular, Stem Cells: An Insider's Guide by Paul Knopfler. He's a stem cell research scientist, I believe at UC Davis. His book was informative and has a very cautious tone, but late in the book, even he mentioned that certain stem cell types may help some arthritic conditions. When I was deciding where to go for stem cell treatment, I found a doctor closer to me in the suburbs who was willing to treat me. His prices were lower for stem cells and PRP, but he was also willing to give me cortisone injections if I wanted them, which was a red flag for me. Also, when I asked how he targeted the correct structures to treat in my shoulder, he told me that x-rays alone were good enough, another big red flag. This is very technical. I wanted a trained and skilled expert in imaging so that the treatments would be guided to the parts of my shoulder that were actually causing the pain. Well, I asked a lot of questions. I was uncertain. Would it work? Would it hurt? How long would it take before I might feel relief? Would I need more than one treatment? I had not had bone marrow aspirated before, so that was a new experience. The procedure was a little uncomfortable, but not terribly painful. Then a series of injections to treat each structure in my shoulder that was damaged, which were again a little uncomfortable, but nothing like waking up after a shoulder surgery. I had swelling for 2 to 3 weeks after the procedure, which concerned me. But I was in contact with Leah and Dr. Tambar, who let me know what to do and what to avoid. They were respectful and supportive. Anyway, I only missed a couple days of work, as far as I remember, because this was my non-dominant arm, and I could get by without using it, as I was not using it a lot anyway. I'm happy to share with you that I've begun riding my mountain bike again, which I haven't done since 2009. I play with my kids within limits. I work on projects around the house. I can drive. I'm doing much better in terms of pain at rest, pain with activity, and my energy has greatly improved too. Also, I have not taken over-the-counter or prescription pain medications since recovering from the procedure. I certainly put a lot of research time into this, and I hope that everything that I've shared is beneficial, but the following I hope can be applied, and I believe it will be. So the first thing I would say is do your homework. Just because this has helped me does not mean that it's the solution for everyone. Before surgery or steroid injections, consider mesenchymal stem cells from your own bone marrow and or PRP for joints and surrounding soft tissue injuries. Also, if you've already had other treatments, regenerative treatments might still help. When considering where to go for treatment, choose a place that specializes in regenerative treatments only and that have treated many patients. Do not make your choice based on distance you need to travel or upfront cost. Your mobility is worth the very best treatment that you can get. Also, Chicago Arthritis, Dr. Tambar and his team are focused on delivering treatments for people that allow them to heal. They have been very respectful to me. They have listened to my concerns, assessed what might be possible for my treatment plan, and delivered cutting-edge treatments that have improved my quality of life. According to my wife, the treatments that I have received at Chicago Arthritis have been nothing short of a miracle. Thank you.